Hello and welcome to the third video in our Future Learn course, Thinking Like a Health Economist. My name is Professor Darren Baines. In this video I shall cover the core concepts of economic evaluation, costs and benefits. Although we're talking about thinking like a health economist and exploring what that means, health economists actually have to provide practical advice. So therefore they need tools and techniques that allow them to collect and process data and help decision makers in health systems make rational choices. When they're undertaking their work, health economists perform something called economic evaluation. Economic evaluation is a set of tools and methods and procedures for comparing the costs and benefits of alternative treatments so that answers can be given to decision makers about which are the most efficient alternatives. In layman's terms, economic evaluation collects the data necessary to perform a cost-benefit analysis. Therefore, if you wish to think like a health economist, you need to understand what economic evaluation means, what costs mean, and what benefits mean. So in this first section we shall discuss economic evaluation. Economic evaluation is a formal method for comparing alternative courses of action in terms of their costs and benefits. Which costs and benefits are measured depends upon the perspective undertaken in the economic analysis. For instance, if a societal perspective is undertaken, all of society's costs and benefits are measured. In contrast, if a patient perspective is taken, then only the costs and benefits that accrue to patients are measured. In economic evaluation studies, a health systems perspective is often adopted. Economic evaluations can help set priorities and assist decision makers in making the best use of available resources. Economic evaluation studies measure the relative efficiency of available interventions, but they do not measure their affordability. An intervention can be cost effective, but not affordable. The four main types of economic evaluation studies are cost minimization studies, cost effectiveness studies, cost benefit studies, and cost utility studies. So, as we can see, the economic evaluation can be done as four main types. And the difference between the four is fundamentally the way that the health economist measures the outcomes. If there's no outcome measured and we assume two treatments are the same, drug A and drug B have the same effectiveness, for example a branded drug and a generic drug, we undertake a cost minimization study. If we are measuring things in natural units, for example the number of heart attacks that patients have or a reduction in cholesterol level, we will undertake a cost effectiveness analysis. If we measure the outcomes in money terms, for example somebody's willingness to pay for a treatment, we call that cost benefit analysis. Those three types are types of analysis available to health economists. There's also a fourth type, and that is called cost utility analysis. And cost utility analysis is done when we use a quality of life measure in order to compare costs and health gain. So, what do we mean by costs and what do we mean by benefits? Because economic evaluation studies all measure costs, therefore we need to understand that concept, but they all measure benefits in a different way. So, in order to think like health economists, we need to understand what those two concepts mean. So in the next section, let's look at costs. In everyday usage, the word cost has many different meanings. It could mean price or the resources used doing something. Within health economics, cost has a specific meaning. It is the value of resources used providing treatments to patients. For instance, a patient may receive a drug which has a price, but the cost is how many resources are used on the whole course of treatment, doctor visits, tests, outpatient appointments, and a whole range of other healthcare interventions. Economic costs are different to accounting costs. Within health economics, costs are the value of resources used treating patients. In contrast, within accounting, costs are simply the amount of money that changes hands. For instance, a patient may receive a 15-minute consultation with a GP at which no money exchanges hands. A health economist will be able to calculate that the resources used in that consultation has a monetary value which they may calculate to be £45. This is called the economic cost. We've learned that health economists have a very particular way of looking at costs. They're not prices. They're not the total that you spend. Costs are the value of the resources you use. They're not the physical units. They're not the number of doctors. They're not the number of medicines. They're not the number of operations. They're actually the value of those things. So therefore, costing is about taking resources used and creating a value. Now, those values can be measured in money terms. You could say the value of a doctor's time is £35 for 15 minutes. But the values that we are measuring in money units are not prices. That's not the amount that somebody would pay for that time. It's the value that we place upon the resources expended. Therefore, as you progress into health economics, you'll realise that an important task is to work out how much you value something. For example, in the NHS, the government sets the value of doctor, nurse and other healthcare professional time and publishes information that health economists can use. In private healthcare systems, the value may actually be the price paid in the market. In insurance-based systems, the value may be the amount an insurer is willing to pay a provider for healthcare. So therefore, as you think like a health economist, cost isn't money. Cost can be measured in money terms, but cost is value. So let's look at the next section. What do we mean by benefits? Health economists are concerned with the consequences of providing medical care. Because treatments are designed to improve the quality and length of patient lives, the consequences of medical care are called benefits. Patients may derive benefits from treatment in many different ways. For instance, plastic surgery may make some patients happier even if they're not unwell. However, for health economists, the appropriate benefit is always health gain. It is measured using quality adjusted life years, or QALYs. These are calculated by multiplying the quality of life times the length of life for a patient following an intervention. Most economic evaluation studies use a quality of life measurement tool. Health economists measure health so that health gain can be valued. They're interested in values, not physical quantities. By measuring values, costs and benefits can be compared and economic analysis can be performed. Benefits are something produced because of the use of a healthcare intervention. Benefits are ultimately what result from the expenditure of costs. When we use resources to create benefits. However, health economists are not just interested in any benefits. If it's patient happiness, but it doesn't improve health, a health economist will not consider that to be an appropriate benefit of healthcare. And the reason it's not appropriate is because resources are scarce. If we're going to pay for something, let's pay for something that improves patient health rather than meets their desires or wants. Therefore, once we know that there's certain benefits that we want to derive, health economists say that it must be health, and that health is measured as a composite measure in terms of quality and length of life. If you live for 1 year in full health, that's called one quality adjusted life year. If you live for 2 years at half health, 2 times a half is 1. So therefore, a quality adjusted life year doesn't just have to be within 1 year. It could be spread over several years. So you could, for example, have a health status that is 20% of your potential health status, and if you accrued that for 5 years, then that's one quality adjusted life year. However, health and quality adjusted life year are still physical units, and as you progress into health economics, what you'll find is that there's special ways of turning quality of life into how much society values that quality of life. Health economics is a particular way of thinking, but health economists have to advise governments and healthcare providers and purchasers. The formal approach taken by health economists is economic evaluation, and this allows a comparison of costs and benefits. However, as we progress, or as you learn more about health economics, you realise it isn't the physical resource units or the physical health gain, it's actually how much we value them. How much society values a doctor's time, values a medicine, values 1 or 2 years improvement in somebody's health. So therefore, if we turn costs and benefits into values, we can have a set of scales. Things can move up and down. And if the value of benefits is greater than the value of costs, then it's rational to choose that intervention. But if the costs, the value of the costs, are greater than the value of the benefits, then that would be a decision a health economist would say shouldn't be pursued.